Hi friends, my name is April. I've been a nurse for over 20 years and I'm starting this channel for a couple of reasons. One is to kind of help and maybe mentor people who are considering the nursing profession and maybe those who are dealing with some burnout and are wondering if they want to proceed to continue in nursing. So I started as a nurse's aide in a nursing home long ago, spent 2 years there, 2 years as a nurse's aide in the acute care setting, and then worked as a ward clerk and monitor tech. Ward clerk is the secretary and person that enters orders into the computer and then coordinates care between the nursing staff and the departments. And the monitor tech is the one that reads the EKG tracings and coordinates with nursing staff and related care required based on that. I decided when I wanted to become a nurse that I was going to look at the 3 ways a person could become a nurse. So the first way is you could go to the LVN program and do an LVN to RN program. That process is approximately a year and a half. And then you still have to do at least another year and a half to complete the ADN program or ASN program. ADN means Associate Degree Nurse and ASN means Associate of Science Nurse. This degree is one that you can obtain at your local community college, so student loans are much less if you choose to do that. You can also take the option of doing it the way I did it. I chose to work through most of my first program and took loans for about the last year of the time so that I wouldn't have too much debt when I came out of school. Now, a lot of places in the country, the ADN or ASN program is still viable. Some of the higher level facilities, especially here in California, they want the BSN. So our University of California system requires that you have a Bachelor of Science before they will consider your application. So just something to keep in mind, depending on if you already have an idea of what facility you might like to work at. I did the ADN route, and in choosing to do that, I was able to start working a lot sooner. And I did eventually do the RN to BSN upgrade in 2019. So I did take some loans for that, but it was easy to pay that off, seeing as how I already had a good job. There have been several times in my career when I've become curious about other departments or have felt kind of like I didn't belong wherever I was at that point. So I've explored several areas of nursing, so I'm hoping that we'll explore that together. In my career, I've worked on a cardiac telemetry floor. I've worked on a cardiac surgery ICU unit, worked in a couple of cardiac Cath labs, and I've worked for different positions at insurance companies. I have done prior authorization and post-service authorization or review at an insurance company. I've done concurrent review with an insurance company, and concurrent review, if you don't know, is the insurance company's version of the case manager in the hospital. So the case manager in the hospital calls and talks to the concurrent review person at the insurance company to get additional bed days assigned. One of the other fun things that I was able to do at the insurance company was assist the medical policy team in areas where I was a subject matter expert, namely cardiac procedures, and updating them so that they were in line with current medical practice. I've been blessed to train a lot of new nurses and just kind of mentor a lot of new nurses throughout my career. So if you are someone that's brand new and there's some kind of procedure you're trying to figure out or something you just still are having a hard time grasping, I'll include a phone number here. Please reach out. I love helping people. If there's anything that I haven't interacted with, I'm perfectly fine learning it and then helping you out. Everybody learns different. Some people learn via reading things or hearing things, and I am open to whatever method of learning works best for you because I want everybody to be successful. This really is one of the best jobs. You can change positions fairly easily without a lot of extra education, and that is one of the things that really drew me first to nursing. The other way I ended up in the nursing realm was when I graduated from high school. I thought that I wanted to be a forensic scientist, but I discovered quite quickly that that probably wasn't going to work for me. So I sat down and thought, okay, so what I really want to do is I want to have a job that helps people, and I want to have a job that includes scientific work in some manner. So I had a friend that said, hey, maybe nursing's for you. So that is why I started at the nursing home. I knew that it was probably best that I figure out what nurses did before I tried to go through all the effort to become one, in case that was something I didn't like. And fortunately, it was something I liked. I've done it over 20 years. The purpose also of this channel, like I said, is to highlight a lot of the different nursing jobs that do exist, some that people may not know, some with a little more depth added. I have a lot of friends that work in some of these interesting areas, and so I'll be having them on to speak about them. One, I have a friend that was a flight nurse, so he's going to speak to that. I have a friend that works in the emergency room that does a little bit of patient care, but she does several other things that are really interesting. So definitely please come back, tune in. We as nurses do tend to be very bad about taking care of ourselves and our emotional, spiritual health. So I've included a free link to a guided imagery session in the comment section. Please access that and just give yourself a bit of time to relax. I also, after saying that I've done this for 20 years, have ended up with back injuries. I actually did find, after doing quite a bit of searching, a company that has a really good program that has helped me out and relieved a lot of my pain. So that's also in the comment section. So today, I just want to speak briefly about the Cardiac Cath Lab, because that is my favorite unit in the hospital. The pros are that you have only one patient at a time, and you get to work in a small area. There's not a lot of running around. You can work with some of the smartest people I've ever met. It's nice to work more directly with physicians, and the interdisciplinary team it's just a very nice environment. So drawbacks to working in the cath lab are it can be a challenge if you have children and a busy home life, because there is a call requirement involved. You are required to have 1 to 2 days a week overnight call and one weekend a month usually on call, in addition to a standard 40-hour work week for most locations. My facility does an alternating 4-day work week with a 3-day work week so that it has the best life work balance. I've never seen anything better, and I love working with our physicians. I've been out of that position for a few years now. I'll go over the job I do now on a later episode. Also love the job I do now. I've been blessed to do a bunch of things. Education for the cath lab. To achieve a cath lab position, you need to have a RN degree. You need to have worked either in ICU or ER. I have heard of a couple of times where they've had new grads go directly into cath labs. We don't do that here, and it probably isn't necessarily in your best interest to go directly to the cath lab, because working in one of the other areas really gives you a chance to develop more of the critical skills that you'll need in order to function in that area, because unlike in the ER or the ICU, there's only maybe one other nurse there working, taking care of this critical patient. So you really need to be up and ready to go and have strong nursing practice with critical care scenarios. I always like people to succeed, so that's the reason that I recommend that. Also, when I worked in cath lab, the nurses did scrub a little bit, so that meant we got to scrub in and help the doctor with the instruments at the table, and it was always really a lot of fun to be able to switch jobs like that. We did a few procedures, so the ones people tend to know about. We do angiograms, or known as heart catheterizations. We did put stents in and did thrombectomy, which is sucking clots out of those coronary arteries. And we did them in a certain kind of environment. So sometimes the patient would be having a heart attack, a couple of kinds of heart attacks we'd manage. One was called a STEMI. That is an ST elevation, MI, or myocardial infarction. That is the kind that when they come into the emergency room, they would activate the cath lab staff immediately so that we would come in and help deal with that situation. The other kind is, they're called NSTEMIs, or non-ST elevation myocardial infarctions. And those are the patients that would come up the next day or maybe later on the same day. And we would put a stent in if they needed that, or get them ready for cardiac bypass surgery if that was what was in the patient's best interest. We also put in pacemakers, several different kinds of pacemakers, just, your standard ones. We would put in ones called biventricular pacemakers, which would pace both the left and right ventricle at the same time to help make the heart work better overall. And we had the kind that had basically a mini defibrillator in them. They're called implantable cardioverter defibrillators. And so those were the kinds that we generally put in there. We did also do stents in leg arteries if that was something the patient was dealing with, the same kind of either cholesterol plaquing or calcium deposit stenosis that we would encounter in the coronary arteries. And we also helped manage stenosis of dialysis access devices, either grafts, which were Gore-Tex or other material created, or fistulas done with the patient's native vasculature. We would do ballooning of them, and then if appropriate, depending on what kind of access it was, we would potentially put a stent in those as well. So again, many episodes to come. Please don't flee. Recharge your nursing career. Very glad you're here. Any questions you have, any jobs you'd like me to explore for a future episode, please leave all that in the comments. And I'm really glad you came to spend some time with me today. Thank you very much.